بسم الله الرحمن الرحيم.
The human kidney is involved in the regulation of glucose homeostasis and in abnormalities found in diabetes mellitus via three different mechanisms: release of glucose into the circulation via gluconeogenesis, uptake of glucose from the circulation to satisfy its energy needs, and reabsorption into the circulation of glucose from glomerular filtrate. Macula densa cells are renal sensor elements, play an important role in regulating glomerular filtration rate and blood flow. The vast majority of glucose filtered through the glomerulus is reabsorbed within the proximal tubule, primarily via SGLT2, sodium glucose-linked cotransporter 2. It is found almost exclusively in the proximal tubules of nephronic components in the kidneys. SGLT2 accounts for about 90% of glucose reabsorption into the blood. Sodium, potassium ATPase on the basolateral membrane of proximal tubular cells utilize ATP to actively pump sodium ions into the interstitium surrounding the tubule, establishing a sodium gradient within the tubular cell. SGLT2 on the apical membrane of these cells then utilize this gradient to facilitate secondary active co-transport of both sodium and glucose out of the filtrate, thereby reabsorbing glucose back into the blood. Inhibiting this co-transport then allows for a marked increase in glucosuria and decrease in blood glucose levels. Cell Laboratories presents CellAmpa. Empaglyflozin is a potent inhibitor of renal SGLT2 transporters located in the proximal tubules of the kidneys and works to lower blood glucose levels via an increase in glucosuria. Also available as CellAmpa M containing empaglyflozin and metformin. Metformin's mechanisms of action are unique from other classes of oral anti-hyperglycemic drugs. Metformin decreases blood glucose levels by decreasing hepatic glucose production, decreasing the intestinal absorption of glucose, and increasing insulin sensitivity by increasing peripheral glucose uptake and utilization. It is well established that metformin inhibits mitochondrial complex 1 activity, and its potent anti-diabetic effects occur through this mechanism, thereby inhibiting fat synthesis and leading to fat oxidation, reducing hepatic lipid stores, and increasing liver sensitivity to insulin. CellAmpa became the most recent medication in its class to be approved by the Food and Drug Administration, FDA. Orally active, selective inhibitor of SGLT2 with a bioavailability of 78% and very limited drug-drug interactions. CellAmpa has a low side effect profile when used in combination with other anti-diabetic medications. Type 2 diabetes. It can be used alongside other medications for type 2 diabetes, such as metformin, sulfonylureas, and insulin. Heart and kidney disease. CellAmpa appears to reduce the likelihood of hospitalization for heart failure or progression of chronic kidney disease in people with type 2 diabetes. Weight and blood pressure. CellAmpa causes moderate reduction in blood pressure and body weight. In patients with T2DM, CellAmpa lowered fasting and postprandial glucose levels. Benefits of empaglyflozin. Lowers A1C, average blood sugar over time, levels up to 1%. Can prevent death from heart attack, stroke, or heart failure if you have pre-existing heart disease. Can be easily taken orally as a pill. Not likely to cause hypoglycemia or very low blood sugar. CellAmpa also demonstrates cardioprotective and renoprotective properties largely independent of glycemic control in patients with T2D.